Okay, so which pulmonary function test is most consistent? Okay, so this is kind of like what we were talking about earlier. So yeah, 68-year-old man working into construction, progressive shortness of breath, non-productive cough, inspiratory crackles, bilateral lower lung fields, reticular opacities, and pleural plaques, interstitial fibrosi. Okay, so it's sounding like mesothelioma from just like exposure to irritants being a construction worker,
Okay.
which would fall under the restrictive. So you would expect potentially decreased residual. You're not going to increase lung capacity. You're not going to decrease the ratios we talked about. It's not going to change the diffusion capacity. It could decrease total lung capacity. So now it's distinguishing between residual volume and total lung capacity. So I would lean towards total lung capacity because I know residual volume is when you breathe out how much of the air remains in the lung. I think
Hmm.
restrictive, you are decreasing the total lung capacity for sure. But I think it actually, since it, like we talked about, kind of either normalizes or increases the FEV1 FVC ratio, you can probably
Hmm.
actually get more air out relative to the total volume of the lungs, even though that
Hmm.
total volume is decreased. So you might say like, oh, your residual volume would actually be normal in a restrictive lung disease, whereas for sure your total lung capacity is going to be down.
Yeah, so this one's kind of tricky, right? Not typically in restriction like asbestos, right? Residual may be decreased in obstructive lung diseases as asthma or chronic, but it should be relatively normal, I think.
Okay.
So it's kind of interesting, right? It's a very tricky question, but understanding what those these terms, right? Total lung
Mhm.
capacity for sure is going to be decreased. That's like directly from your formula, right? So, go with that and then don't get caught up, right, on decrease because, of course, that's going to be a little bit more of your obstructive. So good.